And the University of Guam will now be able to conduct and start a baseline record for research in the Pacific related to non-communicable diseases. UOG was awarded a $2.7 million grant from the National Institute of Minority Health and Disparities through the National Institutes of Health to address the lack of information specific to Pacific Islanders for whom non-communicable diseases, especially cardiometabolic diseases, are the leading cause of death. According to a release specific to the region, the 5-year federally funded grant looks to build capacity to conduct population health research in U.S.-affiliated Pacific Islands, which are often excluded from many national health surveys. Associate Professor of Health Science and Principal Investigator for the grant, Dr. Yvette Paulino, explains that the most significant contribution of the proposed study is an understanding of the extent of diabetes and cardiovascular conditions and related risk factors in our populations. The hope is to track each individual's health over time and use the information to create appropriate programs, interventions, and health policies relevant to U.S. API communities.
We are including children and parents in this, so it's a generational cohort. And part of the reason why we're doing this is because we've been excluded from many of the national health surveys that collect longitudinal data. And so this is one of our ways to be able to look at what's going on in our population outside of the continental U.S.
Throughout the course of the 5-year cycle, students at both UOG and the College of Micronesia will be trained to help collect, analyze, and disseminate this information in a timely manner so that the research continues long after the culmination of the grant cycle.